Cancer is one of the leading causes of death in dogs around the world, and the reality is that many owners only notice when the disease is already in an advanced stage. Studies show that approximately 1 in every 4 dogs will develop some type of tumor during their lifetime, and this proportion increases significantly in animals over 7 years old. What makes this situation even more concerning is that a large part of these cases could have a completely different outcome if detected early. Let's tell the truth that few veterinarians explain clearly. Identifying the problem early not only can save your companion's life, but also means the difference between simple treatment and a prolonged and costly fight. The good news is that there are specific signs you can observe at home, signs that trained professionals know how to recognize immediately, but that go unnoticed by most owners. These signs are not as obvious as you imagine, and some of them may be happening with your dog at this exact moment. At the end of this content, you will know exactly what the 8 most ignored symptoms of canine cancer are, how to identify them correctly at home, and especially when it's time to act quickly. We will also explore the most common mistakes that prevent owners from noticing these signs in time, and how you can become the first and most important problem detector for your animal. Before we begin, please leave in the comments your name and the city where you are viewing our content. Let's begin. Symptom 1. Lumps or nodules. Small lumps throughout your dog's body are much more common than you imagine, and most are completely benign. However, there is a crucial difference between a harmless nodule and one that needs immediate attention, a difference that many owners don't know. Experienced veterinarians know that any growth that changes size, shape, or texture in a few weeks is a red alert sign. Let's explain how to do this evaluation at home. During bathing or brushing, gently run your hands over the animal's entire body, from neck to paws, including the belly and armpits. Benign nodules are generally soft, mobile when you touch them, and remain the same size for months. The problematic ones tend to be hard, fixed, grow rapidly, or cause pain when touched. A technique that professionals use is to mentally mark or even photograph any new lump to track changes. If you find something that wasn't there 2 weeks ago, or that has recently doubled in size, this deserves immediate veterinary evaluation. Remember, dogs with long coats can hide nodules for a long time, making regular palpation even more important. Symptom 2. Wounds that don't heal. Dogs are naturally resistant, and their wounds usually heal quickly, especially small scratches or superficial cuts. When a wound remains open for more than 2 weeks, even if it's small, this is a sign that veterinarians take very seriously. Let's tell what happens behind the scenes. Wounds that don't heal can indicate skin cancer, chronic infection, or immune system problems that prevent normal tissue regeneration. What makes this symptom especially treacherous is that many owners believe that wounds in dogs naturally take time to heal, especially in older animals. This is not true. A healthy wound should show signs of improvement within a few days, with scab formation and reduction of the open area. Professionals know that cancerous wounds have specific characteristics: irregular edges, recurrent bleeding, strong odor, and an appearance that seems to worsen even with adequate care. If you notice that a wound is increasing in size instead of decreasing, or if it has developed a strange appearance with tissue that looks different, don't wait any longer. Photograph the wound and seek veterinary help, as time is fundamental in these cases. Symptom 3. Weight loss or appetite changes. Changes in your dog's weight and appetite are symptoms that go unnoticed with surprising frequency, mainly because they happen gradually. Let's explore something that veterinary clinics constantly observe. Rapid weight loss without apparent reason is one of the most ignored signs of internal cancer. What confuses many owners is that some dogs maintain the same energy level and interest in play even while losing significant weight. Experienced professionals know that internal tumors can consume an enormous amount of the body's energy, causing the animal to lose weight even while eating normally. But there is another pattern that deserves attention: sudden changes in appetite, both more and less. A dog that was always moderate in eating and suddenly becomes voracious, or the opposite. An animal that was always gluttonous and completely loses interest in food. Veterinarians use a simple rule: any weight change greater than 10% of body weight in 1 month without changes in diet or exercise needs to be investigated. A practical technique you can use is to weigh your dog monthly and record the values. Dogs with tumors affecting internal organs like liver, stomach, or pancreas frequently show these signs long before other symptoms appear. Symptom 4. Unexpected bleeding. Blood coming from any orifice of your dog is always cause for concern, but there are types of bleeding that are red alert signs for cancer. Let's tell something that veterinarians regularly see in clinics. Blood in the nose, mouth, feces, or urine can indicate tumors in the gastrointestinal tract, urinary system, or nasal cavity. What makes this symptom particularly dangerous is that many owners wait to see if the bleeding stops on its own, losing valuable time. Professionals know that bleeding related to cancer has specific characteristics. It tends to be recurrent, can start mild and intensify, and frequently comes accompanied by other subtle signs like behavior changes or discomfort. For example, blood in feces may appear only occasionally at first, leading owners to attribute it to something the dog ate. Nasal bleeding can be confused with allergy or dryness. A rule that veterinary clinics follow is any bleeding that repeats more than twice in 1 week needs immediate investigation. If you notice blood in any secretion from your dog, don't wait to see if it improves. Document when it happens, take photos if possible, and seek veterinary care the same day. Tumors that cause bleeding are frequently more aggressive and require rapid diagnosis. Symptom 5. Persistent cough or shortness of breath. Coughing in dogs can have various causes, from simple irritation to heart problems, but there is a type of cough that veterinarians immediately recognize as concerning. Let's explain the difference. Cough related to cancer is generally dry, persistent, and doesn't improve with rest or environmental changes. Experienced professionals know that tumors in the lung, trachea, or mediastinum cause cough with specific characteristics that intensifies at night or during light exercise. What confuses many owners is that this cough can start very subtle, just occasional, making it seem like the animal choked on something. Over time, the frequency increases and can come accompanied by breathing difficulty. A technique that veterinary clinics use to evaluate severity is to observe if the dog presents panting breathing even at rest, if the gums turn bluish during efforts, or if there is change in the sound of breathing. Wheezing, snoring, or strange noises when breathing are signs that deserve immediate attention. If you notice that your dog coughs more than 5 times per day for more than 1 week, especially if the cough is dry and seems to come from the chest, don't wait. Record a video of the cough to show the veterinarian, as this helps a lot in diagnosis. Remember, respiratory problems related to cancer can progress rapidly. Symptom 6. Frequent vomiting or diarrhea. Occasional gastrointestinal problems are normal in dogs, especially those who like to explore and eat inappropriate things. However, there is a crucial difference between an isolated episode and symptoms that can indicate cancer of the digestive system. Let's explore what veterinarians observe. Vomiting or diarrhea that persists for more than 3 days, even with fasting and light diet, are alert signs. Experienced professionals know that tumors in the stomach, intestine, liver, or pancreas frequently cause chronic digestive symptoms that owners initially attribute to food intolerance or stress. The typical pattern is episodes that improve slightly with symptomatic medication but return quickly. A characteristic that veterinary clinics consider especially concerning is when vomiting or diarrhea comes accompanied by blood, even if it's just a darker coloration in feces or small red spots in vomit. Another important clue is when these symptoms appear together with weight loss or appetite changes. If you notice that your dog has gastrointestinal episodes more than twice per week, or if symptoms are accompanied by lethargy and abdominal discomfort, document everything: times, frequency, appearance of feces or vomit. This information is crucial for the veterinarian to make a precise evaluation and decide if more specific exams are necessary. Symptom 7. Behavior changes. Dogs are masters at hiding pain and discomfort, an evolutionary characteristic that can work against them when it comes to early cancer detection. Let's tell something that behavioral veterinarians constantly observe. Subtle personality changes are frequently the first signs that something is wrong internally. Experienced professionals know that a dog that was always playful and suddenly loses interest in favorite activities may be feeling pain or discomfort that we still can't detect. The most common pattern is progressive apathy. The animal still eats and drinks, still responds when called, but energy and enthusiasm gradually decrease. Another sign that veterinary clinics take very seriously is sudden change to aggressiveness or irritability, especially when the animal is touched in certain areas of the body. This can indicate localized pain caused by internal or external tumors. A technique that professionals use is to observe changes in sleep patterns. Dogs with internal discomfort frequently sleep more during the day but become restless at night. If you notice that your companion is avoiding activities they always loved, hides more frequently, or reacts differently to touch, pay special attention. Document these changes for a few days and take this information to the veterinarian, as behavior is a valuable window into the animal's internal health. Symptom 8. Unusual odors. Canine sense of smell is extraordinary, but ironically, it's the owners who frequently first detect odors that can indicate serious health problems. Let's explain something that oncological veterinarians know well. Tumors, especially those affecting mucous membranes or causing necrosis, produce characteristic odors that a human nose can detect. Persistent bad breath that doesn't improve with brushing or dental products can be linked to tumors in the mouth, throat, or even in the digestive system. Experienced professionals know how to differentiate between common bad breath caused by tartar and that more intense and different odor that oral tumors produce. Strong smells coming from wounds are another red alert sign. Healthy wounds don't produce strong odor, but necrotic or infected cancerous tissue does. A clue that veterinary clinics consider especially important is change in the animal's general body odor. Dogs with internal tumors sometimes develop a different body odor than usual, something that attentive owners can notice during petting or brushing. If you notice that your dog has developed sudden bad breath that doesn't improve with dental care, or if any wound is producing strong smell, or even if the general body odor has changed without apparent reason, this deserves veterinary investigation. Record these observations and seek professional help, as unusual odors frequently indicate processes that require immediate attention. Each of these symptoms may seem small when considered individually, but together, they form a powerful alert system that can make all the difference in your companion's life. The reality is that canine cancer, when detected early, has significantly higher treatment success rates. Oncological veterinarians know that the difference between an early-stage diagnosis and a late one can mean months or even years more of quality life for the animal. Let's reinforce a message of hope. The earlier the diagnosis, the greater the chances not only of successful treatment, but of maintaining the quality of life your dog deserves. Regular checkups are fundamental, especially for dogs over 7 years old, but your daily observation at home is equally valuable. Remember that you know your animal better than any professional, and small changes you perceive can be the most important clues for an early diagnosis. Don't hesitate to seek veterinary help when something seems different. It's always better to have an unnecessary consultation than a lost opportunity to detect something serious in time. Your companion counts on you to be their eyes and voice when it comes to health, and now you have the tools to be the best advocate they could have.